Starting solids is one of the most important milestones of your baby's first year. It is when they begin to build their relationship with food, develop their taste preferences, and receive the nutrients that will support their growth and development for years to come. But it is also a phase that raises a lot of questions. When should I start? What should I offer first? How much is enough? What if my baby refuses? What if they choke? During complementary feeding, which is recommended to continue until 2 years of age, the goal is for the baby to experience the widest possible variety of foods with different textures and flavors. But for this phase to happen safely and effectively, there are basic principles that every parent needs to know before getting started. In this video, you will learn everything you need to know to start solids the right way from the very first day. If you want more content like this about baby nutrition, subscribe to the channel. We publish every week. Now let's get into it. Number 1. When to start. Complementary feeding should begin at 6 months of age. This is the recommendation of the World Health Organization, the American Academy of Pediatrics, and every major pediatric body worldwide. Not at 4 months, not at 5 months, at 6 months. But age is only one of the criteria. The baby also needs to show signs of readiness to start eating. These signs are 3. Being able to sit with support without toppling to the side, showing interest in what adults are eating, and having lost the tongue thrust reflex, which is the reflex that makes the baby push out anything that enters the mouth. This reflex exists to protect the baby in the early months and begins to disappear around 4 to 6 months of age. If the baby has turned 6 months but has not yet shown all 3 signs, talk to the pediatrician before starting. If the baby shows all the signs before 6 months, still wait for the recommended age. The 6-month recommendation exists because that is when the digestive system is mature enough to safely process solid foods. Starting before 6 months increases the risk of gastrointestinal infections, food allergies, and childhood obesity. Starting after 7 months increases the risk of nutritional deficiencies, especially iron deficiency, and can make it harder for the baby to accept new textures and flavors later on. Number 2. How to start. The first day of complementary feeding does not need to be a special event or follow a rigid protocol. The goal is simple. Introduce the food, let the baby explore, and observe the reaction. The baby will make faces. They will spit. They will push the food out with their tongue. This is completely normal and does not mean they dislike the food or will never accept it. It is the baby's digestive system and defense mechanisms responding to something new. Acceptance comes with repetition. There are 2 main methods of introducing solids: traditional purees and BLW, which stands for baby-led weaning. With traditional purees, foods are offered mashed or blended, and the parent feeds the baby with a spoon. With BLW, foods are offered in soft pieces that the baby can pick up and bring to their mouth independently. Both methods are safe and have scientific support. The choice depends on the family's preference, routine, and the baby's profile. What the evidence shows is that both lead to similar nutritional outcomes when done correctly. Many families choose a combination of the 2, offering purees at some meals and soft pieces at others. That is also valid and works well in practice. What is not recommended is mixing everything into a bottle. This practice prevents the baby from developing the oral coordination needed to chew and swallow solid foods and deprives them of the sensory experience of exploring different textures and flavors. Number 3. Which foods to offer first. There is no mandatory order for introducing foods. The recommendation is that the baby gets to know the widest possible variety from the very beginning, including different food groups, vegetables, greens, fruits, animal proteins, and legumes. Some important points about the first foods. Allergenic foods such as egg, peanut, fish, wheat, and dairy should be introduced early, from 6 months onward, and not delayed. Current scientific evidence shows that early and regular introduction of these foods reduces the risk of allergy. On the first offer of each allergen, observe your baby for a few hours. Signs of a reaction include skin rashes, swelling, vomiting, and breathing difficulty. If any of these signs appear, seek medical attention immediately. Iron-rich foods should be prioritized from the very beginning. From 6 months onward, the baby's iron reserves begin to deplete, and they become dependent on food to replenish this nutrient. Red meat, liver, beans, lentils, and dark leafy greens are the main sources. Bitter vegetables, such as broccoli, kale, and spinach, should be introduced in the early months of complementary feeding when the baby is in the window of greatest receptivity to new flavors. The earlier these foods are introduced, the greater the chance of lifelong acceptance. What should not be on the baby's plate during this phase? honey, added salt, sugar, fruit juice, cow's milk as a main drink, thickeners, ultra-processed foods, and any industrialized product with chemical additives. Number 4. How much to offer and how often. At the beginning of complementary feeding, portions are small. The baby still receives most of their nutrition from breast milk or formula, and complementary feeding serves primarily to introduce new flavors and textures, not to replace milk. From 6 months, the recommendation is to start with 1 meal per day, usually lunch, with small amounts, 2 to 3 tablespoons to begin with. This increases gradually as the baby shows interest and accepts more. From 7 months, 2 meals per day become the goal, lunch and dinner or lunch and a snack. From 9 months, 3 meals per day plus 1 or 2 snacks is the recommended pattern. From 1 year, the baby should be joining family meals, eating the same food as the adults, with the only difference being that their portion has no added salt and does not contain foods that are inappropriate for their age. One fundamental point: do not force the baby to eat. The baby has a very efficient hunger and satiety mechanism. When they turn their face away, close their mouth, or push the plate, they are communicating that they are full. Forcing them to eat disrupts this mechanism and can create a negative relationship with food that lasts for years. Number 5. How to handle refusal. Food refusal is one of the biggest sources of anxiety for parents during complementary feeding. The baby makes a face, spits the food out, cries, turns away, and parents interpret this as permanent rejection. It is not. It is biology. Babies are born with a natural preference for sweet flavors and a tendency to reject new flavors, especially bitter and sour ones. This has an evolutionary origin. In nature, bitter often signals poison, and distrust of new flavors protected babies from eating something harmful. But in the context of modern complementary feeding, this tendency needs to be worked through with patience and consistency. Studies show that a baby needs to be exposed to the same food between 10 and 15 times before developing familiarity and acceptance. This means offering broccoli once, seeing the baby make a face, and never offering broccoli again is exactly the opposite of what works. The right strategy is to keep offering, without pressure, without obligation, but with regularity. Put the food on the plate. Let the baby explore at their own pace. If they do not eat it, that is fine. Offer it again at the next meal, and the one after that. Acceptance comes with repeated exposure. Another effective strategy is to vary the preparation method. If the baby refused mashed broccoli, try offering it steamed in pieces they can hold. If they refused beans on their own, try mixing them with rice. Texture and presentation make a difference in acceptance. What does not help? Hiding the refused food inside another food without the baby knowing, disguising the flavor with sugar or other ingredients, or using screens as a distraction during meals. These strategies may work in the short term, but damage the development of a healthy relationship with food. Complementary feeding does not need to be perfect. The baby does not need to eat everything from the first day. What matters is consistency over time, offering variety, respecting the baby's pace, avoiding foods that are inappropriate for their age, and keeping mealtimes calm and pressure-free. When to start, how to start, which foods to offer first, how much to offer, and how to handle refusal. 5 principles that, applied together, make the difference between a complementary feeding journey that works and one that generates anxiety for the whole family. The description of this video has a free guide with the complete first-year feeding plan, what is safe, what to avoid, and when to introduce each food. Just click and download. In the next video, we cover 7 ultra-processed foods that seem healthy but are not. See you then.